Hello, I'm here today with Dr. Cheryl King, professor in the departments of psychology and psychiatry at the University of Michigan and the director of the Institute for Human Adjustment. Dr. King, thank you very much for being with us here today and answering our questions.
Thank you for the invitation. I'm pleased to be here.
So today, Dr. King will be talking to us about suicide risk and assessment formulation for children and adolescents. So the first question I have is, if a parent or a caretaker is concerned about their child's behaviors and feelings, how will they find out if their child is at risk for suicidal behavior?
Well, I think first and most importantly is the parent should trust their sense that they have a concern and go with that concern and get a professional evaluation. So parents, the more they can have an understanding of what might be red flags for increased risk. For instance, they see several signs of depression, like their child is no longer wanting to do what they used to do. They're no longer getting pleasure from being with friends, being on a team, hanging out, being on the phone, being on the computer. They're seeming very down and discouraged, or they're showing behaviors that are a concern, substance abuse, declining school grades. They're sharing thoughts that they're hopeless. There are many signs of possibly increased risk that parents could become familiar with. And then they also just have a sense that something has changed. I'm concerned about my child. When they get this concern, I think it's important to take the child for a professional evaluation to get a full risk assessment, but also to share that concern with the child. So the child is not surprised and wondering why they're going for an appointment, and the child has a chance to talk with the parent and get some support. So a parent might say, for instance, I'm concerned about you. I'm concerned about you because I've noticed this, or that you no longer seem to be enjoying something you used to like so much. I'm wondering, what's going on, and I'm wondering if you might have had any thoughts of hurting yourself. Could come out as part of that conversation once it begins.
So which methods for suicide prevention for children and adolescents have good scientific support?
Mm-hmm.